Hey, hi, it's Shena here. So I'm going to sit outside the breast center a little bit and we're going to have a little chat. So it's a really nice little coffee chat. Got some, So this is a really good dark roast. It's from the cafeteria here at the UW Hospital on Highland. And hospital food at the UW is good. So we're going to have a little chat. So coffee chat today. Today, it's been 3 years since I was diagnosed with breast cancer, and it's been very emotional. I've had some tears this morning. This is very, very emotional because 3 years ago, it completely changed my life. And I just had a really good, some things finally threw my thick noggin. I think, I overthink things and I get too into detail about stuff, and so I kind of often make journeys harder on myself. But with that in mind, really good report today. Things were explained to me more in depth about my kind of cancer, about the treatment we did, about what I can expect for continued care. I am feeling very, very settled, and I learned the difference between my kind of cancer and other cancers. And there's also, and I'm very, very fortunate because of doing the bilateral mastectomy and the immunotherapy and the chemotherapy. By doing all of that, so the chemotherapy went in and it attacked any extra cells that were in my body after my breast was moved with the invasive ductal, invasive lobular cancer, and the primary tumor was removed from my body. So there was the removal of the cancer there, and then the chemotherapy goes in and it sweeps up any of that stuff. It totally kills all of your cells in your body so that they regrow, and cancer free. And then the immunotherapy for having cellular cancer. So I sit here and I think, that all the time, cancer's laying in wait in my body. Now, if I stopped taking the tamoxifen, I'm sure it would probably come back in an instant. So I know women that have stopped the tamoxifen to get pregnant, and that has, their cancer has returned. So, and the way this was explained to me was because we hit my cancer, we hit it hard. That we are great. So we've got the insurance policy of the immunotherapy, the insurance policy of the endocrine therapy, and at the end of 5, 7, 10 years, if we decide to go off of the endocrine therapy, if any of those little sneaky cancer cells laid in wait, then, they would rear their ugly heads again. It's a harsh realization, and, I got through my thick noggin today, with these scans. Yes, they are important, and I've been thinking, we need to catch it. But the kind of cancer I have is slightly different because it is, if it comes back and metastasizes, it doesn't matter when we catch it. It's not curable. So that needs to shift in my thinking and how I'm feeling about things. But today's an emotional day. Got done with my early appointment. I am going to go rest, but I wanted to explain a little bit more about that. So now I have some research to do, and I feel like a big butthole for, really trying to push my doctors into my care and for not understanding fully. Cancer is so different. I mean, even within breast cancer, different types of breast cancer. So I'm feeling better knowing that, hey, if cancer does come back, then, I'm dead. Like there's no curing it. I know that sounds morbid. But what I feel confident in is the fact that the treatments that we used, we hit it hard. We hit it with the most aggressive ability, and we are possible, and surgeries and everything as a preventative measure. So from here on out, now it should just be healing. And the other part that's difficult for me is I had the existing chronic pain condition before the cancer, so I've already had all of that. So this is like a buildup. So that makes my case a little bit more complicated, is having that. And that's why it is also taking me so long to recover, because I already had the fatigue, the tiredness from living with chronic pain, chronic migraines, the depression, the anxiety associated with that, and then on top of it, you add the cancer journey. So, all right. Well, it's Shena Collins with Shena Strong. We are coming up on being 2 years cancer-free, but it is the anniversary, 3-year anniversary of my breast cancer diagnosis. October is Breast Cancer Awareness Month. Wherever you are at in your fight, or if you're a caregiver, stay strong, or if you're somebody that knows somebody, but cheer everybody on, and thank you. So I'm just going to keep chugging ahead, rebuilding my life. Today I feel like I got a pass. So now I just need to continue building up my energy. I feel like I have a more concrete plan moving forward. I'm not out here in that space where I'm floundering around as a patient, as many oftentimes cancer patients do. Once they are done with all the major parts of the treatment, you kind of feel dumped, or feel like that dog dropped off at the shelter, and kind of don't know what's up or what's going to happen. And I feel that today I feel more confident, and it was good. So, yay. So now it'll be 1 year for another PET scan, in which I was told that I've been given special care and treatment, and that makes me feel good, and that I'm worthy. So it helps build back some of my worth. And I was also told that I'm fortunate that I was permitted to undergo the back flap surgery with all of the complications I had, and that it's really awesome that I'm a success. So things to smile about and be happy about, and that's what's going on. All right, everybody, it's Shena Collins with Shena Strong. Have a great day. My spirits are a little lifted, but I'm tired. It was an early morning, and just, this has been a long road, and the emotions and the feelings that are stored in my body and my soul and emotions are there. But happy hump day. Bye, everybody. Have a good day.